Hi everyone, my name is Janich Morales, and today I'm going to demonstrate or perform oxygen administration. Oxygen administration is method which oxygen is implemented at higher percentage. Then, what is available is atmospheric air, and purpose is this prevent hypoxemia and hypoxia. And also, alligate associated with strangle to breath. First, before we proceed our procedure, check the doctor's prescription. The next, perform hand hygiene and wear a gloves. If available to prevent a spread infection in microorganisms. Okay, next, explain the purpose and procedure to the client. Providing information if poster or build cooperation in allays his or her anxiety. Good day, ma'am. My name is Janich Morales, and I'm your caregiving for today. And today, I will administer you for your oxygen by nasal cannula. Is that okay with you?
Yes,
So, thank you, ma'am. Okay, how your day and how your feelings?
I'm good.
Okay, so that's good. So, the purpose of this procedure, ma'am, is to prevent hypoxemia and hypoxia, and also alligate associated to stronger true clips. Before start the procedure, can you state your name, ma'am?
My name is Blessed George Morales and my birthday is January 2005.
Okay, nice to meet you, ma'am. Okay, so I will assemble the equipment and I will be back. Okay, next, I'm going to assemble the equipment, the rationale behind this for accurate skill performance. So, I have here this one is improvised nasal cannula. Let's assume that this is a nasal cannula, like this. And this is improvised also an oxygen tank, like this. Then, next also, in this one tape, it is optional. For the next step, prepare the oxygen equipment. First, attach the flow meter into the wall outlet or oxygen cylinder. Okay, this is a flow meter, like this. So next, fill the humidifier about 1/3 with the arterial water. So, humidifier prevent a drying of nasal mucosa. Okay, as you can see, this is the humidifier. We are going to fill about 1/3 with sterile water. Okay, the next step is to upload the gas in oxygen cylinder. So the reason behind this is to prevent entering gas from the next of cylinder to nostril. So next we are going to attach the cannula with the connecting tubing to the adapter on the humidifier. So this is our improvised cannula. We are going to attach the cannula to the connecting tubing adapter to the humidifier. So now, I will attach the cannula on the humidifier. Like this. So, I will turn the oxygen tank like this. So, we turn the oxygen tank at the prescribed rate. So, next, I will test the flow by setting flow meter at to 3 meters and check the flow on my hand. Like this. Okay, the rationale behind this is the provide a prescribed oxygen to the client or patient. We can adjust the flow meter setting to the other flow rate. So the flow should not exceed to 6 meters per minute. So higher rate may because of drying of nasal mucosa. So be careful of that. And now, I'm going to insert the nasal cannula into the client nostril and adjust the tubing behind the ears. Like this. And slide the plastic adapter to the client's chin until she is comfortable. Okay, proper position allow the unobstructed oxygen flow in cases client respiration It also maintains sufficient lock-in oxygen tubing to prevent a tubing from getting out of place accidentally. And also, we encourage the client to breathe the nose rather than the mouth, then expire from the mouth. Because breathing to the nose inhale more oxygen than the trachea. Then the next we will instigate the oxygen flow to maintain the doctor's prescription and also to avoid toxicity. Then the next we will assist the clients respond the oxygen in comfort level because the anxiety and causes demand of oxygen like this. The next, depose gloves if you work and perform hand washing to prevent spread of infection and microorganisms. Then place no smoking, significant, and enter in the room or under the bed of clients. So this is a sign once the clients, visitors that smoking prohibited because oxygen combustible. So next is documentation. We are going to document the time, date, method, flow rate, and respiratory condition and response of client to the oxygen. Okay, documentation provides a coordination of care and also we are going to sign the charts to maintain the professional accountability, senior staff to the any abnormalities or condition of the client to provide continue of the care. So next, we are going to check oxygen setup including the water level in the humidifier. So check the oxygen setup. So explain the cannula and assist the client every 8 hours. So sterile water need to be added when the level falls. Okay, so now let's proceed to the simple oxygen mask method. It is usually used to the low, moderate amount of oxygen it. Simple mask contains a hose on beside to the lead XL to proceed suffocation in case of blockage. So, and it can deliver amount to 40-60 percentage or percent to 6 to 10 liters. So hand hygiene or wear gloves available to prevent spread of infection microorganisms. And next, explain the procedure or purpose of the procedure to the clients. The client has raised to know what is happening and allay his her anxiety. Good day, ma'am. My name is Janet Morales, and today I will execute or perform simple mask method. Is that okay with you?
Yes.
Okay, so that thank you, ma'am. Next, we are going to attach the humidifier to the credit outlet of the flow meters or regulator. And next, we are going to connect the tubing from the simple mask of the nipple outlet on the humidifier. This is improvised. Next, set the oxygen at the prescribed flow rate. Okay, the oxygen must be flowing before you apply the mask of the client. Then apply mask guide elastic strap. So this one is the strap. Over the top client's head. And bring the strap down to the just below the client's ears like this. But from deep fold the strap extension to the center. The mask of the clients face with the teeth cell. Okay, the rationale behind the cell prevent lights as much as possible. And make sure the client is comfortable so it's help to relieve apprehension. and no lower oxygen is needed, and properly remove the gloves, pre-warm and perform and hand washing to prevent infection and microorganisms. Then next, we are going to document the procedure and client's reaction. So documentation provide contamination of care, and also we are going to sign the charts and report to the senior staff to maintain professional accountability. So now I will check the client's depresses, respiration, and increase of pulse. Respiratory condition, and to find out abnormalities as soon as possible. Okay, then lastly, I check the readed precious area under the straps. Okay, the strings when not place pressure on the underlying skin areas of the clients. So we are going to check the readed precious areas of the clients. So that is for today's video. Thank you everyone.